Hi everyone, welcome to this Friday seminar. Today we are going to have Marie-Louise present for us. I guess it spans your two roles, really, Marie-Louise, School of Health Science and within Tichy as well. And the title is How to Plan for Health Research Impact. If you'd like to take it away and share your screen now, Marie-Louise. Yeah, perfect, can see it, all good.
Great, thanks. Thanks everyone for coming today. I am presenting on behalf of the School of Health Science and the Tasmanian Collaboration for Health Improvement. Before I start today's presentation, I'd like to acknowledge the traditional owners of Lutruwita, Tasmania, the Palawa and Pakana people, and express my gratitude for their care of the land, and also acknowledge the impact that colonisation has had on the health of the Aboriginal people, and also identify that it's an intent of the collaboration to work towards addressing some of the inequities that have resulted. So today, I've got quite a few things to get through. The first part of this presentation will just talk a little bit about the collaboration and its role in knowledge translation, and then start probably a discussion on knowledge translation, perhaps presenting a couple of different definitions or the way in which that process is described, and then talk about how and when to plan for the impact of research. I've put together a couple of templates, and all of the resources that I'm using today will be available on the new collaboration website, which will be launched very early next month. And so hopefully by the end of today's session, that people in the audience will have, some more information on how to use knowledge translation strategies, both in practice and in research. So the Tasmanian Collaboration for Health Improvement is a collaboration between a number of partners, and that includes the Department of Health, the University of Tasmania, Primary Health Tasmania, and Health Consumers Tasmania. And the goal of all of these organisations is to help develop and implement a shared translational research agenda that will deliver health improvements to our community. We are actually an emerging research translation centre, and we're the only one in Tasmania. There are 10 research translation centres that are endorsed by the NHMRC around Australia, but we're the first one in Tasmania. And we have some key priorities, especially addressing our rural and regional health challenges, and working together to implement research into practice. The aim of all of the research translation centres is to speed up the implementation of health research into practice and service improvement. So we have 4 main strategic priorities, and these are to enable the increasing translational research in Tasmania through the support of clinical research capacity building, as well as accelerating research translation. And we're keen to involve consumers and communities at every stage of the pathway. Also very keen to develop Aboriginal research and accelerate research translation. For us, it's really important for the health of Tasmanians that the research is translated into policy or practice change and deliver tangible improvements across our population. Increasing translational research, that is the type of research that investigates how best to implement what is already known into practice or the next stage of the impact pipeline, is a focus of our ongoing work. So this image, I think, is really a nice way to try and get a picture of all the different ways in which people conceptualise translating research from basic sciences all the way through to population and community level translation. Although our research agenda focuses on research involving humans, and translation can occur from the proof of concept all the way along to optimising determining what conditions will optimise that, and moving research out of highly controlled environments into real world settings, testing therapies or interventions in primary care clinics, and then going on to research how to implement these into benefiting the population more widely, including policy changes and programs at a population level. So I'm going to spend a little bit of time talking about knowledge translation, because knowledge translation has evolved as a concept over probably the last couple of decades, and some people use it in different ways. Some people describe that process of moving activities from the laboratory or from a research output into the hands of the people who will use it as research translation, knowledge transfer, knowledge exchange, mobilisation, or research implementation. So although there's slight nuanced differences in these, and people in different countries and contexts, preferably will use one term over another, the intent is the same, is that there is importance for research that's been generated, not to just it's really important that it actually is put into the hands of the people who use it for maximum impact. And if you think about why that's important, it's important from a number of points of view. And I think it's an ethical imperative actually to make sure that the research that is generated is able to be used and impact the people that need it the most. And so the people and organisations who can use it need to be able to access and use it. And I think the idea of planning is really important, because it doesn't happen naturally. I think there's a current figure of around 17 years from very basic sciences to people having evidence-based practice or care that's based on evidence-based practice. And you might think that's bad, but it used to be a lot worse. I'm not sure how many people know James Lind, who was a naval officer, and he was quite famous for being one of the first people in the world in 1747 to do a randomised controlled trial. And so he did a trial to determine if citrus fruits would help the sailors getting scurvy, which it did. So 1747, he actually published one, which is great, but then it was 120 years later before the Royal Navy put into policy that addressed the nutritional benefits of citrus fruit for their workforce. And there was huge casualties along the way. Over 70% of people died in the pre-Napoleonic Wars. And so I'm not sure if people are familiar with the James Lind Alliance that now holds his name. And I think it's really relevant to bring that up today, because the Alliance is based on trying to determine health research priorities from the perspective of people with lived experience. So for a lot of different clinical conditions, you can find the top 10 priorities that people with lived experience have to help guide researchers when they're determining what research it is important to do. So I want to spend a few slides talking about when and how knowledge can be translated and how to plan for it. And there's two kind of approaches to this. One is integrating knowledge translation throughout the whole research pathway or impact pathway, and the other is at the end of the project as well. So both of these are important and relevant. One of the examples that I'd like to use now is one of the TICHI projects, which is Healthcare Connect North. So this recent local example in our state is a project that was designed to try and overcome the difficult issue of people who are high medical users at the Launceston General Hospital. So consumers were involved at the beginning and at all stages through this project. They're involved in the working and advisory groups as well as the steering groups. And in fact, it was one of the consumers who who suggested the final service model that was actually used. So longitudinal data collection of the people involved in co-design as the project goes on, with all throughout the conceptualisation of the design, the implementation and the operationalisation of it, with ongoing input from the consumers, is currently underway. And of note, all of the partners in the Tasmanian Collaboration for Health Improvements, including UTAS, Primary Health Tasmania, the Department of Health, Health Consumers Tasmania, and general practitioners contributed, and a further partnership between the THS and Primary Health has been established for service delivery. And an important finding from this work was that having a common purpose and a need for all of the partners to be included. And I think that's really fundamental to the process of integrated knowledge translation. I also want to point out that in knowledge translation processes, that the process is often not linear. So out of that work, here's another project that was generated, and a new co-design framework that uses evidence-informed and experience-based co-design that was conceptualised by Tanya Winsenberg and Claire Morley. And this model has 5 phases, but you can see from the graphic that they've developed that people with lived experience are very much at the centre of this model. So throughout the process, participants are encouraged to voice questions, and that can be addressed by rapid, responsive and focused evidence synthesis using existing evidence and data linkage. And this project vision is that all stakeholders, particularly people with lived experience, can come together and work for improving the outcomes for people with high healthcare utilisation in Tasmania. And again, we've got another example of an integrated knowledge translation project that was generated from another project with a similar philosophy. Another way that knowledge translation planning can be done is to consider, when the findings of the research are known, how they're going to be disseminated. And so I'd like to use another local example from Shauna Gall and Susie Waddingham that describes a very productive end of grant knowledge translation. So there was planning that went into that to make sure that the findings of this study were disseminated widely. So this is a picture of media. So 2 of the participants were involved in some media that came out. This project's designed to to investigate youth smoking and vaping in Tasmania and consider what changes would result from increasing the legal smoking age to 21. So as well as media outputs, there are presentations to a range of stakeholders, including Parliament, Menzies, the participants, community organisations and retail and members of the public. They made a video, they made an infographic, a 2-page summary for stakeholders and reported back to the funding body. And I've included an image of the infographic here, because if we think about providing information in a way that's accessible for people to increase the impact and readability of research findings, then this is actually a very effective way of getting information across. And so providing plain language summaries or graphical representations of knowledge is a knowledge translation strategy. So the last couple of examples have used knowledge translation from a researcher perspective, but in fact, there's another way to look at integrated knowledge translation, and that's from a health professional's perspective. So if the health professionals consider what in their practice they would like to change, what changes they'd like to address, if there's an evidence to practice gap or just something that they want to change, they can then determine what implementation strategies to use, and then some evaluation of how that's going to be undertaken. And again, focusing on Tasmanian projects, the Festival of Ideas project is a clinician research and mentoring program that's offered by the Allied Health Strategy and Research Unit and in the Tasmanian Health Service. and in collaboration with the University of Tasmania's College of Health and Medicine. And the purpose of the program is to assist health service clinicians to develop basic research skills and to develop a relationship with the university. In the course of designing and conducting a small project that's meaningful to their clinical practice and service priorities. And the program's open to all health professionals, and small group submissions are encouraged. And this program's been running for a number of years and runs all year. And this methodology can be equally as relevant to research as well as for quality improvement processes that are constantly underway within our health system. So I've provided a couple of examples of knowledge translation, both in an integrated and end of project context and from a clinical perspective. And these have, there are a few of them described there. I can probably come up with nearly 30 different knowledge translation strategies that are effective in improving knowledge transfer into practice. But I'm going to pause right now and invite people to put into the chat box any knowledge translation strategies that they've used that have been found to be particularly effective. And if you've got any other questions, you can pop them in the chat box now. I have Kerry Turnbull, who is who works as the Consumer and Community Involvement Coordinator for the collaboration, monitoring the chat box for me. So if I think of, oh, yep. Oh, good. I'm glad we've got a little bit of action in the chat box there. Kerry, it's difficult for me to open that with as I'm presenting. Yep. Would you mind just going through those for me? Yep.
Absolutely. Thank you. Yes, we've got some different strategies coming in: social media, radio, TV, patient and health professional workshops for consumers, sitting down or stand-up training in hospitals, workplaces, and other things that have been helpful, developing with relationships with industry to share findings, creating a flyer with relevant information for families, children's public talks and school visits. So lots of different methods coming in there, Marie-Louise, still coming in.
Yeah, that's great. And so as we go through some of the planning, you'll see that some of those strategies are kind of product based, you know, so providing, you know, a plain language something, providing something for providing an output, you know, some media, and some of them are people based. So I think some of I heard there that people were talking about partnerships. Training is interesting. I would like to know if people have what people's perspective is, but in the area that I work, we know that education alone is not enough to shift health professional practice. So there are a lot of other ways in which we can support health professionals to change their behaviour to deliver evidence-based practice more often. And we'll go through some of those as we're going through the rest of the presentation. Kerry,
a couple more here. Yep. So we've got asking the community what would work for them. It's another strategy. Bringing children into the hospital to review some of the consequences of risks, and on-site coaching. Another one around transferring findings into policy.
Yeah, sure. So we've got actually, again, kind of the idea of involving the end users of the research. So, you know, having children or other people, you know, understanding things. So involving them in identifying the kind of research that they want to have undertaken. I think it's really fundamental, if you want people to change, that you actually need to make sure that the things that are being researched or investigated are things that are important to them. I had a really interesting experience when I was doing my postdoc in Canada, and I listened to a wonderful PhD presentation from a zoologist who'd been researching in the east side of Vancouver, which is the socio-demographically challenged area, a lot of homeless people in Vancouver because it's too cold in the rest of Canada to be homeless. And so she talked to them about the rats, you know, being a zoologist, and, you know, did all this really a great PhD. But then somebody put their hand up and said, if you'd asked the people if rats were the most important problem to them, would they have said that? And she said, oh, no, they were much more worried that they were homeless. So I think it's really important that we do answer the questions that are important for the people who we hope to use our research.
Just a couple more have come through as well,
Great.
Marie-Louise, before we move on. An art exhibition, which I think is also interesting, and a model of care as a culture of practice.
Yes. Yeah. Oh, so I think there's some lovely kind of alternative things, and I'm really glad that nobody said, you know, we've got all the academic kind of outputs, but, you know, reaching out to the public, and, you know, certainly arts-based KT is something that I find really really quite innovative and really quite exciting and different. Thanks, Kerry. As you're going, if you want to put some more questions in the chat box. My screen's not, here we go. Okay, hopefully I won't go through 4 slides now. So I'm going to just go through 3 different ways in which people can plan for knowledge translation. And again, I just want to emphasize how important it is to plan for knowledge translation. I know people say, well, I don't know what I'm going to find yet. So I don't know what the research findings are. So I can't actually plan for disseminating them because I don't know what they are. But I don't think that's true. I think you will know who is going to be interested in your findings, regardless of whether the answer is yes, something works, or no, it doesn't work. So I think it is really important to plan. And I think it's also really relevant that a lot of funding bodies now require a KT plan. And as we're talking about the different kinds of KT strategies, you realise that, in fact, you can't do them, apart from having a Twitter account maybe, you can't actually do them with 0 money. So you need to plan for knowledge translation, and you need to put it in your budget as well if you're going to make sure that you maximise the impact of the research that you're undertaking. So this is actually a very simple kind of approach to looking at knowledge translation and determining, and there's only really 3 kind of decisions that you have to make once you know what your message is. So once you've decided what the single most important message that you've got, then you need to choose your KT goal. So we've heard from a number of people that some of their goals might sound like raising awareness. So if the goal is to raise awareness, then doing something like media, raising awareness for the general public, then media would be an appropriate kind of linkage of your goal, your audience, and your strategy. So I've chosen one that's practice based because that's just that's where I sit. So if, for example, the goal, rather than being raising awareness, was something like facilitating practice change, maybe the goal, we heard one earlier about impacting policy, which could be really important. We might like to inform decisions or share knowledge. It may be something about technology development, or your research actually may go on, like the study we saw before, to inform future research. I think it's then important to think who your audiences are. So if we've got, so practice change, obviously having healthcare practitioners as the audience, but there may be other research scientists, policymakers, patients, consumers, industry, or the public that may equally be the target of your audience. And then you might choose a range of different strategies. So I think we talked about educational workshop or training, but in fact having the support of somebody to help embed practice change, I think, is important. So one example might be academic detailing or educational outreach, where you have some mentoring and academics supporting practice change. You could actually have something like a knowledge broker, an opinion leader or a champion. You might have a multi-professional collaboration network or a community of practice using information technology, practice tools or decision-making aids, audit and feedback. Somebody did say arts-based KT before, electronic reminders or social media, clinical practice guidelines are one strategy that can help support practice change, policy, education material or educational opportunities, workshops and training. So there's a number of different strategies that people could use. What I'm going to go through now is a more comprehensive knowledge translation planning tool. It's got 13 different stages, and I'll just walk you through the kinds of things that you might consider when you're developing a KT plan. And certainly this resource that comes from the Toronto-based clinician scientist KT training, there's a link to that on our website, or will be shortly. So we've seen that collaborations are really important. So thinking about who are the people that are going to be important for this project success. So I think researchers certainly have a lot of background in the area, but if it is that some of the impact is going to, if some of the impact that you want to, if some of the effects that you want to impact are related to the public, certainly having members of the public, health consumers involved will be really important. It may be that decision makers or policy makers might be also very important. Industry may be important, and sometimes you need to include the funders as well. So thinking about how they'll be engaged, we've talked about integrated knowledge translation, where the partners are really important at the inception. Actually researching their ideas is probably a good idea as well, but really having engagement from the idea formulation, right across the project or at the end or beyond the end of the project. And I think it's important to consider how they'll be involved and what each partner will bring to the project. And so it may be that they can help with actually executing or applying the knowledge translation strategy and or evaluating it. And I think there's some really nice resources that have come out of Canada as well, looking how patients can be engaged in research and really developing and supporting their roles. And I know Kerry's working on a lot of strategies from the collaboration to support how patients can be engaged in research. And then it's probably good to make sure that there are people with knowledge translation expertise, and this might be scientists, consultants, or organisations such as the collaboration. Once you know who your project team is and making sure that you've got the relevant partners on board, I think it's good to consider who might benefit from this. And so considering who the knowledge users will be. If you're working in the area of basic science, the people who may benefit from your research may be other researchers. And that's just one example of translating for impact for people who are going to be the end users of your research. It may be health practitioners or service providers, the public, patients, consumers, decision makers again. So there's a range of stakeholders that you need to consider when targeting or developing your knowledge translation plan. And then you need to determine what your message is. And I know it's hard sometimes before you started the project to know what the message is, but I think you know what the message, who will benefit from the message and what the message will entail. And so it may be that you can tailor the messages to the different knowledge users. So it may be that the strategy that you use and the message that you have will be different to the different knowledge users. So it may be, for example, if you have clients or patients, you'll make a patient decision-making tool, and that may be about raising awareness, and at the same time you might have a different knowledge user who will be a health practitioner, and what you're hoping for is to generate some practice change. So you might look at having an opinion leader or someone help change practice, and one of your other knowledge users might be a policy level or an industry-based partner or knowledge user who you'd like to use potentially a different strategy, writing a policy brief for them. And I think there's probably a get out of jail free option on this one, like no idea yet, but we'll work on that. So I think that's a really nice way to conceptualize what you're doing. And then we've got, again, the different kind of goals that you can have. You know, for some people, some projects or some messages, you know, if it's something very novel and new, you may just be wanting to generate awareness or getting buy-in. It may be that your knowledge is quite new and you have some different facet that you want to share. Or it may be that you've found something that is really important that you think will inform decision making, whether that's patient decision, other researchers, health professionals or policymakers. And again, practice or behaviour change can relate to a number of different stakeholder groups. So thinking about what the goal of the knowledge translation is for each of your knowledge users. Okay. So I talked briefly before that there are different kinds of knowledge translation strategies, and they can be role-based or more product or output based. And the roles that we know are effective in knowledge translation are having a knowledge broker, which is a person who is the linkage between the researchers and the clinicians or the end users of the research. Having a champion or an opinion leader embedded in the organisation that the change is desired to occur is another knowledge translation strategy. And having a consultant might be someone in a leadership position or somebody, or maybe a collaboration that helps to facilitate the uptake of the new knowledge or practice. And from an educational point of view, there are, you know, handouts, brochures, toolkits that can be used. Plain language summaries, I think, are really important, and you know they're quite ubiquitous now. You know, any Cochrane review that you read has a plain language summary. Lots of patient-facing materials has something that's quite plain language, so that the information that's being produced is actually produced in a format that's really accessible for the end users. And I guess that's why I like the arts-based KT. If you can get your message across in something that's more pictorial, I think that's really important. We've talked about workshops and conferences and in-services. So we've got event-based things, but then more enduring networks and community practices can really embed practice change, especially when all members of all stakeholders are involved in the network. And then when you think about who the knowledge users are, we can actually look at those networks or collaborations. I've presented a couple of times at the Menzies, at some of the Menzies professional development days, and they've got some really nice examples of where collaborations between Menzies and some mainland universities have really enhanced the way that the impact from work being done in Tasmania can be distributed throughout Australia. And if we look at educational knowledge users, we've got publications, conferences, workshops, and social media as a technological solution. We've got role-based and educational-based as well. And commercialisation or technology transfer, I think for the brave-hearted, we know that the University of Tasmania has some staff who can support that. Talking about when KT will occur, I think we spent a fair bit of time today already talking about both integrated and end of grant KT, and sometimes both are appropriate. And then no planning would be complete without determining how it's going to be evaluated. So it may be indicators around reach, indicators around usefulness. I think describing partnership or collaboration indicators is challenging. Although I know Kim Jose at the Menzies has done quite a bit of work in that space within the public health realm. There are service indicators, policy indicators, measuring knowledge change, attitude change, or system changes are all possible. And there are some questions that you can use to guide your evaluation in terms of who's going to value it, how does it add value, and will you focus on process or outcome evaluation factors or both. So when you're looking at planning in the budget, also thinking about the resources, and resources may be financial, but they may also need to, they may be person-based as well. So coming back to the first point on this plan, making sure you have all of the relevant partners involved at the beginning is really important. So you may need to have some governance, leadership, management, people involved. And sometimes you may be able to use volunteers or other people to help with the resource implications of your project. There's a number of budget items there that you can consider. And then pulling it all together at the end is looking at how you're going to execute your plan. So the third way in which I've seen knowledge translation plans written is they're written using a logic model format. So considering all of the inputs, and you can probably overlay some of the more detailed information from the previous model in terms of, inputting for people and resources, looking at the outputs, which are the shorter term outputs, and then really thinking about the impact and the outcomes that you expect to see in the short, medium and long term, and then considering what external factors or assumptions may impact the success or otherwise of the knowledge translation plan. So in summary, there are a number of tools that can assist researchers to plan for knowledge translation, and planning should occur at the very start of the project, and planning should include project design, funding and considering impact. We know that knowledge translation can occur at any or it can occur at all stages of the research journey, and that projects that engage stakeholders throughout the knowledge translation process, the whole process, are more likely to see their findings used. And I think when we think about impact, that's probably the most important, the most valuable thing, if we can make sure that our findings are used. So to support people further developing their research plans, we thought that it would be effective to offer a virtual drop-in session to provide knowledge translation advice and consults for research projects and also for grant applications. So we're going to trial from the 7th of June for 6 weeks a virtual drop-in session via Zoom. So the link is here, but we'll also make sure that it goes onto the website, and you certainly can email us at Tichy if you'd like to be involved with that. We can help provide resources and talk people through some of their planning. The next Tichy presentation that Kerry's going to be taking, that's entitled Getting Started with Consumer and Community Involvement in Research, will be on the 21st of June at a similar time. And there's more details in the newsletter. We're also really interested in knowing from you if there are any other professional development opportunities or webinars for researchers, health professionals and or consumers that you'd like us to provide. And so I'll invite you now, as I'm getting towards the end of my presentation, to put in the chat function if there are any other further developments that you would like. Any other further professional development activities that you would like us to perform. And so, so my last slide before I pause for questions is to encourage anyone who would like to connect with the Collaboration for Health Improvement. It's free. We actually have regular newsletters, and the website is actually undergoing quite a bit of renewal, so that there'll be lots of resources available for you there. You can certainly scan this code or go to tg.org.au and join up and get some of the resources. So I might stop. I'll leave that there for a moment, and I'll ask Kerry if there's any other comments or questions in the chat, and then I'll stop sharing in a minute and answer.
Thanks, Marie-Louise. That was great. Just while we're waiting on anyone who wants to make suggestions around other seminars and things they'd be interested in, we had a comment around Pain Revolution outreach, bike ride and education tour to disseminate contemporary pain science to education in rural communities, which I thought sounds like a really novel way of knowledge translation out into rural areas. So that was one that had just come in our previous list. Yeah, so I expect that's Kate Andrews who's posted that, and I might actually ask her to explain that. So I think what Kate's going to describe is something that I'd probably call a toolkit, which is a number of different strategies that are bundled together. Kate, did you want to just spend a couple of minutes just going through the kind of strategies that are used to make sure that people who may want to use the evidence can access the most current evidence-based approaches? Yep.
Sure. Can you hear me okay?
Yep.
So I think Pain Revolution it's a collaboration that's come out of the University of South Australia. And it's a collaboration between researchers and clinicians and consumers that have persistent pain. And we know that there's a big evidence gap between what we know helps persistent pain and what's actually happening in clinical practice. And despite the guidelines clearly recommending against things like surgery and medication for persistent pain, those strategies are still on the rise. So Pain Revolution was a response to that, and it was about trying to take contemporary pain science out into rural and regional communities to try and educate the public about contemporary pain science. So the outreach tour is probably happening this year, and it's probably the 5th tour that's happened. So it's a number of strategies, as Marie-Louise mentioned. There's a bike ride that raises awareness, and the riders raise funds that get put back into training health professionals to be local pain educators in their communities. So that's a little bit about it.
Yeah, and Kate, when the members of the collaboration cycle around, do they hold town halls, or do they hold public forums to talk to
there's
people?
lots of forums happening each day in various community locations, and they have they call it a brain bus. So they have a vehicle that travels around and does community engagement activities in shopping centres and schools and public places as a practical way to engage people in understanding pain science with different sort of experiments and virtual reality and things like that, little illusions to help teach people about a contemporary understanding of how pain works.
Yeah, and I'll just pick up on a couple of things. So what you're talking about is providing information that's accessible, so actually where people are, but also in different formats that are likely to engage them. Kerry, have you got anything else in the chat box? Or I'm going to open up to the floor if people would like to put their hand up. We've got maybe 5 or so minutes before we should.
Yeah, there was just one other comment while we're waiting for people, if anyone wants to ask a question. Here we have one. I'm interested in any IT resources for survey design, infographics and design options. So that was one that's come in terms of an interest for resources, it sounds like. So IT resources for survey design, infographic design, and other options.
So just in terms of survey software, I think I would be confident saying that our ethics committees require us to use REDCap as a tool. I'm not sure if the question is more around how to design surveys. In terms of designing infographics, I've used the Noun project, which actually has like nice graphics. You do have to either acknowledge or pay a small fee for them, but you can actually get some really nice graphics that way. I'm really happy if any people would like to post in the chat or put up their hand if they've got any other resources. Rajan's interested in the consumer workshop, so that's next month, and I actually think that will be a very popular one as well. Canva is good for making infographics, and actually I was in a workshop yesterday and somebody suggested Mural. I don't know, M-U-R-A-L, Mural. It's a collaborative. Actually, it was Kieran who said that she'd done some thematic analysis, like having two people putting up like post-its on a board. Would Kieran like to talk about using Mural as something that was a tool that was really useful?
That's correct, Marie-Louise, what you've said. It's a visual collaborative tool, rather than being in one room and putting stickies on the whiteboard. This is whiteboard online, where we can move stickies around, and it's really helpful with thematic analysis when 2 or 3 collaborators are working together.
Yeah, but equally, I think you could use it if you're designing an infographic,
Yes,
or putting together a plain language summary, just as a collaborative workboard. And I understand there's a free version, which is always really helpful.
We've got another comment there around, is it probably another piece of software called Prezi, P-R-E-Z-I, Prezi?
Yeah. I think Prezi's been around for a while. I'm not sure if it's actually more functional than it used to be. I haven't had really great experiences with Prezi. I'm not sure who suggested that and whether it's actually more useful now. Who suggested Prezi?
It's Sean.
Oh, Shona. Okay, so Shona, tell me how you've used Prezi that you think would be a good way to get like a knowledge translation message, or get information into a usable format.
Thanks, Marie-Louise. I use Prezi all the time. It's useful for making presentations and graphics, infographics. You could also use it for making logic models, all things which you've mentioned today. So I find it quite good, although I actually had a discussion about it with Kieran recently, and we agreed that when you're making presentations out of it, that's not necessarily, that's a bit hard to, share them and view them without the software itself. But for downloading still images, like PNG files and stuff, I find it quite good.
Yeah, I think we probably might need another in-service on how to use Prezi, because I've used it for presentations and not loved it, but obviously it's got lots of features that I'm not familiar with. So thanks for sharing that, Shona.
Yep, no worries.
Thank you. We've got another suggestion here for a workshop around a co-design approach specifically.
So is that for a future?
Yeah, for a future professional development, really around a specific sort of co-design.
Well, I'm not sure if that person has some psychic ability, but later in the year, we're planning, the collaboration's planning a panel discussion where we're going to be getting 6 researchers to present some participatory action-based co-design kind of different methodologies. So we're looking at World Cafe, kitchen table, and a couple of other different methodologies. I'm not sure if Susie's there. She's going to hopefully present on the kitchen table, but actually thinking about how you can involve consumers in research design, the kind of methodologies that support that. So certainly become a member, watch that space, and that'll be available for you, I think, before the end of the year.
Thank you, Marie-Louise. We have another one person here requesting the link for the tool that you demonstrated. If we could pop it in the chat. That's something that's easy enough to do. Otherwise, we could email it around afterwards. Yeah,
I can. I don't have it copied, but I'll just pull it off the internet now. It's from the Toronto Children's Hospital KT training, and when you log on, there's actually all of the suite of resources are available through our website, because as well as the training tools, they actually have training. There are a couple of webinars on very basic knowledge translation. The KT game and a few other resources are there, but as well as that, they do actually provide training. I think they came out to Australia to provide training a number of years ago. I think Andy's done the online version, but with the east coast of America, it's kind of nearly 12 hours difference, so it's a bit of a hard thing to do in real time. I'll actually have to ask Deb if we can put the slides from today on the Teachie website. Is that something, Deb, that we have the capacity to do? Yes, thumbs up. Okay. No, I didn't say that, Kate, but now I will say that the slides from today will be available on the website. Are there any other questions?
nothing else there at the moment, Marie-Louise. That was our last question. If there's any last ones, I'll just keep an eye on the chat. Are you wrapping up?
Yeah, happy to take a question from the floor. Otherwise, I'll hand back over to Darren to close the meeting.
Well, good. Thanks for that presentation, Marie-Louise. I think we're right with the chat box. There's no other hands up for questions as well. So put our hands together and thank you for that presentation.
Yeah. It was a pleasure, and always a pleasure to talk to you about the collaboration and knowledge translation. And yeah, so certainly I look forward to seeing some of you in Kerry's presentation next month.